Welcome to our AI segment, where I will share 3 safe, free, and helpful ways you can start using generative AI at your surgery center today. If you have reservations about using AI or have concerns about how it will be safely implemented in healthcare, you are certainly not alone. Anything that garners so much attention so fast should rightfully give you pause, especially when patient safety could be impacted. I feel strongly, though, that the best way to understand how AI works and what it truly is to just get started and start small and dip your toe in ways over which you have full control and there's virtually no risk. So I tried to keep all of that in mind when putting together these 3 examples. You'll definitely notice a theme with the 3 of them. They are meant to help with some of the lower value tasks, if you will, that are simply administrative. And by pulling in some support, you will save a ton of time. These examples don't include PHI. They don't pose any data risk to you at all. So you should feel very comfortable getting started. Lastly, you'll notice that I reference ChatGPT in all of these examples, as that is the AI tool that I use. They have a free version that works great, and I would recommend trying, but please know that there are other tools out there if you'd prefer a different solution. Okay, so use case number 1 is creating staff schedules. Scheduling staff at your surgery center can be a little complex and time consuming. You have to balance availability, skills, preferences, all while making sure that you have adequate coverage. So, ChatGPT can help with this kind of logistical headache. Here's how it works. So all of these will start with a prompt, right? And as you use ChatGPT or other AI solutions more, your prompts will get better and better, and you'll have to do less tweaking. But that's just something that comes with practice. First, you have to input your prompt, right? You want to input variables such as staff names, their availability, roles, shift preferences, any specific constraints like requested days off or maximum working hours. For example, this is a little simplified, but it should give you the concept here. You can use a prompt like, I have 5 nurses: Jenna, Daniel, Marie, Emma, and Caleb. Our morning shift runs from 7 a.m. to 3 p.m., and the day shift is 11 a.m. to 5 p.m. We are open Monday through Friday. Jenna cannot work Tuesdays. Emma cannot do the day shift. Can you please create the schedule for the month of August? It should be as balanced as possible, and every person, except for Emma, should do both shifts throughout the week. So in this prompt, we're giving it kind of those boundaries and parameters. So within seconds, right, ChatGPT is going to analyze your prompt and is going to generate a schedule that optimizes staff allocation. I would say requests like this will probably be completed by ChatGPT in about definitely under 30 seconds. And you can actually converse with the system too, right? So you can say, actually, Daniel can't work August 23rd. Can you please tweak that? So you can go back and forth with the system, either tweak your prompt or just give feedback after you see what it spit out. And then you might realize you missed a holiday in there. You missed, okay, wait, I told you Jenna could do day shifts, but she can't, whatever it might be. You can go back and forth with the system like that. So by using AI, you just streamlined the scheduling process, and hopefully it'll save you a ton of administrative time and also improve staff satisfaction if they know it's done with if the schedule has been created in a fair and unbiased way. And then with all of these prompts too, over time, any AI tool will learn from your feedback and will continuously improve. So even if you didn't put it in the prompt, it's going to look at its memory history and it's going to see, oh, last time we did X and they liked it, so let's do it again, that kind of thing. So that's your first example, creating those staff schedules. Use case number 2 would be patient education materials. So, providing proper education to your patients obviously helps decrease the repetitive questions your staff gets. It helps make patients feel safer and keep them engaged, and it will also improve your outcomes. So, here's how AI can help. Let's say your ASC keeps getting the same patient question, right? How long will it take me to recover from my total knee arthroplasty? And you want to create some collateral to give to the patient or maybe even use on your website. So you can go to ChatGPT and say something like, My surgery center keeps getting the same patient question. How long will it take me to recover from my total knee arthroplasty? Can you please create a one-page document that very simply explains CPT 27447, answers how long it will take to recover, and any other frequently asked questions? A reminder that this procedure will be done in an outpatient setting. So that's your whole prompt right there. So it's funny because that last sentence, a reminder that this procedure will be done in an outpatient setting, is something that I've learned from using ChatGPT. So when I first put that prompt in without that reminder, it spit out everything I needed except it was for a hospital setting. So that was a tweak. So after I got back what ChatGPT created, I replied and said, "Thanks so much. However, this is actually going to be done in an outpatient setting. Can you please update?" And it did exactly that. So again, just learning those prompts and tweaks as you go. All of that to say, within seconds, ChatGPT will give you back what you asked for and typically will expand in areas it thinks would be helpful. Now, because this is going to the patient, you want to, of course, go through it with a fine-tooth comb, make any necessary tweaks. The system is really good, but it's not perfect, so that clinical review will be key. But if I had to guess, you'd likely be able to use at least 90% of what ChatGPT has created for you, and it might actually spark other content ideas, and you can continue using that content wherever you need it. So that second example was patient education. All right. And our last use case today is around post op instructions. So, very similar to the above, you could ask ChatGPT something like, "Can you please write very simple post op instructions to a patient who just had their cataracts removed?" So, giving more examples of those prompts and that tweaks and how we're evolving our requests. Maybe that they what they create is just a little too heavy on the medical jargon. It's a little too advanced. Um, you could then say, "Thanks, that all looks great, but can you please use a tone that is compassionate and direct? And please explain it in layman's terms." So you can keep tweaking it as you go until you get the exact answer that you want. So now we're starting to add in guidance around tone and complexity levels, all of which obviously you can tweak in your prompt for the next time, but just a learning from this time. Now, again, this example of the post op instructions is truly medical advice. You'll absolutely want to give it a read and make edits before publishing it. I would anticipate that you would need to update it based on your ASC's policies and what your physicians recommend, but it will hopefully get you maybe 80 to 90% there and save you a ton of time. So there you have it, 3 examples of how you can start using AI at your surgery center today.